If you have had knee pain for months and have not experienced lasting pain relief from conservative treatment methods, including pain medication, joint braces, physical therapy, or knee joint injections, you may have a painful bone defect, sometimes referred to as a bone marrow lesion. If your doctor diagnoses you with a bone marrow lesion, or BML, you may be a good candidate for the PRESERVE knee study. Let's further explore bone marrow lesions and the aim of the PRESERVE knee study. What is a bone marrow lesion? A bone marrow lesion, or BML, is a term for a finding on MRI that shows where your body is trying to heal small defects, sometimes called microtrabecular fractures, inside of your bone. BML can form through different injuries to the bone, and evidence shows that if a chronic BML is not treated, it will not heal on its own. The progression of a BML could cause the knee to deteriorate to a point where knee replacement is the likely surgical option. What is the PRESERVE knee study? The PRESERVE knee study is investigating whether the benefits of an arthroscopic procedure are improved by adding the subchondroplasty procedure for patients who have a bone marrow lesion. All patients in the study will receive a knee arthroscopy procedure. What is knee arthroscopy? Arthroscopy, or scoping, is when your surgeon inserts a small video camera called an arthroscope into the knee joint. This video is displayed on a monitor, which the surgeon uses to evaluate damage inside of the joint. Damaged areas are then treated with miniature surgical instruments. 2/3 of patients will be randomly selected to also receive the subchondroplasty procedure with arthroscopy. What is the subchondroplasty procedure? The subchondroplasty, or SCP procedure, is a minimally invasive surgery that targets and fills bone defects associated with chronic bone marrow lesions. The subchondroplasty procedure will use X-ray imaging to help guide a small drillable tube to reach the area of the bone defect. Acufil bone substitute material, or BSM, will then be injected through the tube into the bone defect. Once in bone, Acufil BSM will set hard to mimic the normal characteristics of bone. Over time, Acufil BSM will gradually be replaced with new bone during the healing process. What can I expect after surgery? Patients are typically treated in an outpatient setting, returning home the same day of the procedure. Your doctor will recommend a short recovery plan for arthroscopic surgery, which will be similar whether or not you receive the SCP procedure. Who qualifies for the PRESERVE knee study? Criteria for study eligibility include, but are not limited to, you are diagnosed with a BML in your knee, are 30 to 75 years old, have a body mass index or BMI of 40 or less, have experienced knee pain for at least 3 months, are willing and able to have the study procedures completed and attend scheduled visits, are not a daily user of products containing nicotine, and are not taking prescription pain medication for conditions unrelated to your knee. Talk to your doctor about additional study criteria, potential risks, and to learn more about the PRESERVE knee study.